Hello and welcome to Bridging Barriers. So glad that you joined us today. And this is a community just where you can take steps towards transforming any barriers into opportunities for growth. So today we can bridge these barriers and that hold you back. And I just like to invite you to schedule a call or go to my website, suejansen.ca, and let's talk more about that and more areas that you might find being difficult for you that you want to kind of just talk to somebody about. But today I'm really excited. I want to again welcome you today. And we are honored to have Dr. Kimberly Fraser as our guest. And she is a true champion for family caregiving. And as this podcast's audience is a lot of parents with children with adaptive needs and also adults with adaptive needs, she's perfect fit for us. And I'm just so glad that she's here today. And so she is a nursing professor and she's an expert in family caregiving, home care, case management, and also health policies. She's been involved in that as well. Dr. Fraser has spent her career providing invaluable wisdom and support for caregivers navigating unexpected challenges. That's exactly why we're here. So in addition to her academic achievements, I'm going to brag about you a little bit more, Kimberly, before I introduce you. Dr. Fraser has embarked on an impressive second career as an author. And her books, one is called The Accidental Caregiver. That's what attracted me to her. And also her second book is called The Care Book. And it offers practical guidance and heartfelt insights, transforming caregiving from an overwhelming task into a purposeful and intentional journey. So certainly she's exploring new creative frontiers with her memoirs, Pilots, Polar Bears, and Patience. I want to hear all about that. And a historical nonfiction narrative on Canadian aviation. So she's a multitude of gifts, and I'm so excited to introduce her to you. And just one last thing, though, she is a jewelry maker and a yoga instructor too. So she's the what do we call that? Full when you've got it all, you're the EGOT or something. But anyway, Dr. Kimberly Fraser, thank you so much for being here today. Welcome, welcome. Thank you for coming.
Well, thank you so much for having me. I really appreciate it, Sue.
Oh, thank you. So tell us a little bit about you so that our audience kind of knows a little bit more about you and why, and especially I'm anxious to hear more about the accidental caregiver. So tell us more about that first.
Sure. Well, as you mentioned, I am a nurse researcher, was a tenured nursing professor at the U of A for many years, and I retired, some might say a little bit early, to embark on a career as an author. And the reason I did that is because I am passionate about family caregiving, have done a lot of work with family caregivers, both one-on-one and through my work on the board for, I suppose nearly 10 years with Caregivers Alberta. Caregivers Alberta is a not-for-profit organization that advocates for the voice of family caregiving in all things public policy, bringing awareness to employers. They work with caregivers one-on-one and work closely with government and are largely funded by Alberta Health, so our government. And I think it's important that governments do support caregiving initiatives because, after all, caregivers do alleviate a lot of pressures from the healthcare system. Most people, not all, certainly not all, that's another issue when people don't have family caregivers or someone advocating for them, but many people who are either receiving some kind of care through home care or continuing care or in the hospital will have someone called a family caregiver. So when we talk family caregivers, we're not talking professional caregiving. We're talking unpaid family caregivers that might be a spouse, it might be a partner, a daughter, son, niece, nephew, neighbor, or friend, in that role, providing that unpaid support to help someone who's dealing with either a short-term acute anomaly like getting a hip or a knee replaced, or more chronic illnesses like severe arthritis, for example, maybe frailty due to aging, because many of us are aging well. There's lots of supports. We're much more aware of lifestyle. So while many of us age well, not everybody does. And we want to age well, but sometimes we don't have a lot of control over some of the things that happen to us as we get older. But as you mentioned, caregiving isn't only for elderly, infirm folks. We do a lot of support with children with extraordinary medical needs, functional insufficiencies where they need additional care and support. So it is a wide gamut of caregiving. And so I retired early to embark on this notion as that I had in my head to be an author, because I wanted to provide more materials like books, workbooks. I do workshops, those kinds of things, and talk to people one-on-one to help them navigate the system. I really wanted to produce research and evidence-based products that reach the individual caregiver, because as an academic and a professor, a researcher, you know, a lot of the writing that we do, and we certainly do tons of writing, tons of publishing in academic journals, most of the people accessing that kind of information are students, other researchers, either from our own field, in my case, nursing, but also medicine, rehab medicine, sociology, all kinds of folks, but it's all academics or people in an academic environment that are interested in reading academic journals. So I went to town to learn how to be an author and have my book in places like Indigo, Audrey's, if you're in Alberta, those kinds of places.
Cool. Awesome. And so, and when you were talking about the caregivers, and what I was always thinking in my mind, because we always personalize these things, right? Is my granddaughter is 12 now, and her mom has respite workers for her that come in, but they are paid. So I still consider them caregivers, but they are paid. So that's that differentiation.
Because the person that I would be, of course, I'm interested in the health and well-being of all of our health professionals, but it would be your daughter who is the main caregiver for her daughter.
Definitely.
But then she needs a whole cadre of people around her, like yourself, perhaps some of her siblings, other family members who provide support to her, who step in, because there will be never enough money for us to hire paid caregivers in all instances. Never. It's not affordable. That's why I also advocate for government in the way of perhaps financial reimbursement, tax benefits. People have to sometimes either reduce their work hours or retire entirely to help look after a loved one. In my mom's case, she did retire early as an RN. My dad had MS and he died at home, but he had MS for 21 years, which probably was an indicator that drove me to the kind of nursing I've always done, which is community and home care.
And that's so important. I mean, and how you don't go to school to learn that. It's like there's nothing that trains you up to be able to do that well, or even if you don't even know if you're doing it properly or not, some things. So what else do you offer for people who are the caregivers? Like, I know, because you have the 2 books, right? And then, so what are the key things? Yeah.
Well, I do have 2 books, and people can access them easily. We'll talk about that at the end of the show, I'm sure.
Okay.
But one is examples of other caregivers. There's 9 caregivers represented in my book. It's told like a story. It's a narrative, going through the various things, because as much as every single situation is unique, and as unique as the person being cared for and the caregiving situation of the caregiver, we know there's a lot of things that overlap and that all caregivers need to know. For example, how to take care of yourself. And I don't take that lightly, because what is meaningful for my own self-care might be different than yours, or your daughter's, or my mother's, or my neighbor. So we all have preferences that are important to us in terms of our own self-care. And so we want to maintain those, because if we don't keep ourselves healthy, we're not going to be able to be in this for the long term. And unfortunately, a lot of caregiving situations last for years. And it is, something that we do willingly in most cases, but sometimes it's also reluctantly. We're often thrown into these roles because we're living in a situation that people would rather not be in. Somebody needs help. And so we want to be there for our loved ones, our family members, our neighbors. But we need to be also armed with information. So I talk about that in my book, because information is powerful. And we need to understand what services are out there for us. What can we access? How can I tap into some services that will help me while still maintaining my loved one where they want to be? So
Right.
I advocate for strong home health care programs, keeping people in place longer. And we know that's an important quality and value that many of us hold near and dear. We want to stay in our homes for as long as possible, but it's not for everybody. That's why
Right.
we also need options like long-term care centers, nursing homes, they used to be called, or assisted living facilities where people can age in place and get different services. But so I talk about different options. I talk about, communication and the way we talk to each other, and how family caregivers talk to health professionals and the system to advocate for what they need. And there's a way to do that to get what you want. Sometimes, and I shouldn't say get what you want, get what you need.
Yes.
And to articulate your needs in a clear way that the people that you are trying to work with to access services fully understand your situation. And so in the case of home care, we have case managers that come out and do assessments and things like that. But if we're not articulating the needs that we have for ourselves and our loved one, they might not hear us. And so clear communication and being able to advocate for what you need is really, really important. So I talk about that. I talk about the roles of different services and health professionals. And I talk about dealing with grief and loss, because typically when we're caregiving, we're going through those things. So, thinking about what we're grieving and what we're losing and where the trajectory of our situation is going is so important. Unfortunately, we can't be an ostrich and keep our head in the sand and be an effective caregiver, both for the person we're caring for and to look after ourselves. We have to really go into the situation with our eyes wide open and ask ourselves, what am I able to do? And what am I willing to do? And what am I not willing to take on? And there's all kinds of things that might be. And, for example, sometimes people need a lot of care, and home care will provide personal care, not housekeeping. Well, you might think, well, housekeeping is what's going to save me. My mom refuses to have anybody but me do her personal care. So how do you articulate what those needs are, both working with your mom to explain because there's always going to be limits to our public system. And I would advocate that we need limits, because we don't have enough money to keep everybody at home forever and ever and ever with one-on-one professional care. It's just simply not possible. So what kinds of systems and solutions do we need to build as a society, but then also around individuals to meet individual needs?
Right.
So we're always balancing in healthcare how to meet the needs of the individual and how to meet the needs of the system, so we have enough to go around.
That's a big balancing act. I was just talking to somebody the other day about the importance of that communication, and that's so true. Just on our a couple podcasts ago, and yesterday I was speaking to a lady who wants to be on the podcast, and she's out of the States. Her concerns are not the same as ours. Her concern, she was complaining about people not being fitted properly for wheelchairs, that their postures were off, that their heads were hanging, and that they weren't being taken care of in that sense, and that there was nobody. And I said, well, do you have agencies there that help you, fit in your wheelchair and to help you with those adaptive things that you need to get around? And she said no. And she was in southern states. So it's interesting, I guess. It's so different everywhere we go. And I think we're fortunate here in Canada, and we're in Alberta, of course, but yeah, those needs are so diverse, aren't they? Like right across. I guess it depends on where you live.
Exactly. And finding the right information. Sure, things are geographically dependent. Like here in Alberta, we've got remote areas, we've got rural areas, suburban and urban. So meeting the needs in all those communities might look slightly different. But being armed with the right information, like who do you ask for to get fitted for your wheelchair? We have things called seating clinics. Most people don't know there's seating clinics and what they do. It's why would we know about that if we didn't need it? And that's the same with many, many services to help clients at home. equipment and supplies. We have a program called the Alberta Aids to Daily Living
Mm-hmm.
that helps provide equipment and resources for
Mm-hmm.
certain kinds of equipment and
Yeah.
things like that. We have lending programs. The Red Cross does some things. And again, it depends where you live. So this whole notion of information
Mm-hmm.
is challenging, and it's really hard for the system
Mm-hmm.
to have a one-stop shop. Although we try,
We try.
you
Yeah.
need really sophisticated case managers that are able to help you navigate
Mm-hmm.
and get all you need, because it's not one stop.
No. It's it's interesting that the my designated nonprofit is my daughter's, and it's called I Can Play Too, and it's for parents with children, where they can actually all children, all abilities can go and play. And so there's sensory rooms, there's different rooms that accommodate different abilities of each child, and it's also like she has a hub on her website, and I'm trying to establish that on my website as well, to share that with her, where people who, like Candace, my daughter, for example, when her daughter was 8 weeks old, she had near SIDS. So she, after 5 weeks, not even knowing if she was going to live, she has occipital brain damage and parietal brain damage. So she has cortical vision impairment and cerebral palsy. But when she comes out of the hospital with this beautiful baby, then we're just so grateful she was alive. Like we can't even imagine. I can't.
Absolutely.
It was horrific. And so we were just so grateful but my daughter didn't even know the questions to ask to get help at the time. And they did lead her, like they did give her information at the stollery, of course, but it's just like there's so much information, and now you're in overwhelm, right? And so
exactly.
That's kind of why I want to have my website and this podcast as well, as for those people to come to say, what do I do? And figure out what help me figure out the questions I need. Now you're good now. I see you now. Can you see me?
Okay, good.
Okay,
I
good.
can.
We're good. We're
It
good.
did freeze for a moment.
Good. Yeah. Yeah. So anyway, so I'm just really glad that you're doing it. Yeah. You go ahead.
No, I was just going to say, in terms of the information, that's why I came out with my second book called the Care Book. So the first book is The Accidental Caregiver, Wisdom and Guidance for the Unexpected Challenges of Family Caregiving, because sometimes we don't know what we don't know. But as we approach the situation, we realize, okay, getting information, being armed with knowledge can help us be empowered. But sometimes we're overwhelmed with sticky notes, because where do we write notes? Sticky notes. Do we have that book by the phone? And so I advocate right off the hop, start using a scribbler, something that's stapled. Even if you have to flip through that book to find what you're looking for, at least everything is there. And then I came out with the Care Book, which this book is like a personal care planning book. So it's a planning and resource guide to support caregivers going from accidental to intentional.
Wow.
Because if we can be intentional in our caregiving, that can help us. So there's everything in there, from describing the person you're caring for, their likes and their dislikes, keeping track of their medications, keeping track of all their therapies, or if they get any home services, to their physicians, to their specialists, to any equipment and supply providers, who they are, writing down everything in this one place, and also personal directives, end of life care, end of life planning, who are your insurance providers. So really, it is a soup to nuts portfolio for the individual. And once people buy this book, if they prefer to keep it in a binder, they message me and they can download actual sheets and set up it differently, or do it digitally if that's their preference. So
that's great. Is that on your website? Because in the program notes, I have your website is on the description of the program notes, so people can find you there.
It is both my books and other products and books that I've written are all either on my website, but there's links to my publisher, because I decided to go traditional route. I'm not self-published. I have an agent, a publisher, who maintains distribution. So they're available anywhere you can buy fine books. So from online, direct through my publisher, Indigo, your local bookstore, you can ask for them anywhere. and you
Oh,
can find them by searching me, searching caregiving,
yes.
or a link through my website.
Awesome. So we'll be sure to have that link there,
Mm-hmm.
in the description. So everybody, please check that out.
Mm-hmm.
So for you in the future that you're looking forward to, I know that you've got some, you're a guest on a radio program. So tell us about that, and about your other book as
Mm-hmm.
well.
Right. Well, I've been on lots of small radio programs and different podcasts since, my book came out. I do workshops. I'm, featured in different newsletters and magazines. But yeah, the Current reached out. They're doing a series on health and aging, senior care, a whole cadre related to this. They do similar things like this. So I don't have a lot of details yet. I'm just in discussions, and the producer and I had a session. So we're looking at late winter, early fall, and of course, as soon as I know when that is, I'll be putting it up on my website so people can listen. And the way the Current works, it's real life issues affecting Canadians, and so we'll be talking about actual caregivers, and there might be a few of those on the call as well. So that's coming up. I am working on a third companion book to my caregiving books on self-care.
Okay.
So a book specifically for the caregiver. It'll be a journaling type book, affirmations, very inspirational, but a book that the individual caregiver can create themselves as a support for them. As well as my memoir. I started nursing up north in fly-in only communities as a community health nurse in nursing stations, so all over northern Manitoba and the eastern central Arctic. So have some really fun experiences, and I did that off and on from through the 80s.
Yeah.
Let's say that's when that was. And so, doing everything from medevacs to public health to delivering babies and pretty serious interventions for folks, because there were nursing stations, which means staffed by nurses, and we would have visiting docs in some of the communities that will come in, some physicians, specialists, ophthalmologists. So how healthcare is delivered in the north is quite different. So I did that. That's how I started my nursing career, and it was really, really satisfying and a lot of fun. And then I moved into health centers in First Nations communities in rural Manitoba, which was again quite something. And so the book spans 10 years from the time I get out of my first nursing school, because I kept going back to school. I became a diploma nurse at a hospital, did a post-RN at Dalhousie, then a master's in health education and promotion, and later my PhD at the U of A. So
good for you.
In between all of my degrees, I was able to really support myself well as a registered nurse through Canada's North. And so I tell the story up until I meet my husband, incidentally, who was a pilot, and we moved to Alberta. So, and then our son, we have one son, and he's 25, and he's a commercial pilot. So he started flying with us at 4 months old. So we've flown back and forth across Canada a lot, down through the States, up to the Arctic. And so our son kind of comes by this naturally. And so that led me into interest in our local airport. So I'm on a board of a small local airport. Well, small, but has 100 hangars. It's Cooking Lake Airport, and it's Canada's oldest operating airport.
Wow.
So the likes of Watt May, Roy Brown, Lee Brentnell, so very, very early aviators who were known as flying aces out of World War I, World War II, who did some really cool things, used Cooking Lake as a base. So from 1926, when it first was licensed, I mean, there was activity coming out of there before that, right up till now, where we have over 100 hangars and a very active recreational, commercial, lots of bush flying, float plane flying. So lots of different kinds of flying come out of there. So we're celebrating 100 years in 2026. And I am writing the history of that airport, but you can't tell that history without telling more about Alberta history, World War I and World War II, and Canadian aviation, because the World Wars did a lot to push aviation forward. So it's quite a project. It's but I like to learn new things. And so people say, why are you doing that? Where did you learn how
Yeah.
to do that? I said, well, I don't know. I'm learning as I go. So
Yeah.
so I write primarily nonfiction. This is historical nonfiction, but writing history is really fun. So
Ooh.
I've done a lot of research, but now I'm doing some interviews with some local folks with some, insider knowledge of a lot of things. So it's really fun. So it's back to my
Yeah.
research roots where I'm interviewing and analyzing the interviews to
Oh,
support the book. So
that's
so
exciting.
yeah,
That's
yeah.
exciting. Congratulations. And that's really, that's a wealth of knowledge that you've got, and that you're in the right place, in Alberta to gather that. I think that's wonderful. Good for
Oh, it's
you.
it's it's really it's really fun. So
Uh, oh, that's
mhm.
awesome.
But
Well,
caregivers and caregiving is still my passion. When
yes.
you talk about what do I do to support them, well, I do some workshops for different groups, but every week I'm talking to people about caregiving because they know
Mhm.
my history, know my background, know my books. And so just giving people that individual support sometimes is just pointing a friend of a
Mm.
friend in the right direction in their community, where to go get help, what they can expect, because there's a lot of caregivers. 1 in 4 Albertans is a family caregiver.
And it's getting worse. Do you
Yeah.
find the numbers are going up there? Like, is
Oh,
that change?
absolutely. They're getting
Yeah.
higher. And it makes sense because
The baby
with
boomers.
technology and advancement,
Yeah.
we're keeping people alive, even babies and little ones. We have got great interventions, thankfully, that can keep people alive, can intervene to give them an opportunity at a life. And
Mhm.
sometimes it's at, a lot of costs, and you know, and it comes often at cost to the family caregiver. And then you're right, with healthy aging initiatives, we're able to, even if we live long, there's not too many of us are going to get into our 80s and 90s without at least one chronic health condition,
Yeah.
because of lifestyle or otherwise. We've
Mhm.
got a lot of environmental factors that affect our health,
Mhm.
genetics, etc. But we're able to keep people alive
Yes.
at all costs. So,
Mhm.
I think as we go into the future, and you're right, just the tremendous amount of baby boomers, yeah, we're really creating a bubble. And now we have that inverted triangle. So all the baby boom that came up, we had, massive children. And as we went up, older people were smaller populations. Now we've got this inverted triangle that you've
Upside down.
probably heard about. So we've got this massive growth in older Canadians with shrinking numbers because we have smaller families. Who's going to be looking after whom and in what circumstance? So,
Exactly.
we do have some societal things to think about.
We do. We do. And that
Mhm.
caregiving is huge.
It
And
is. It
like,
really is.
I
And
love the title of your book, The Accidental Caregiver, because that kind
mhm.
of says a lot, because you don't plan. You don't plan
No,
on being a caregiver, and it's
well, you don't know when it's going to happen.
you don't know.
Um,
You don't know.
and I don't know about you, but I've just had a lot of friends being diagnosed with some pretty crazy stuff
Yeah.
lately.
Yeah.
And you know, we come home, if we're lucky, and live quite well.
Mhm.
But sometimes we need those supports. Like
Yeah.
it's a snowstorm today. Older people, even the healthiest of older people, might choose not to go out and drive in a snowstorm. Well, maybe they need their medication and it
Yeah.
has to be picked up because they ran out, and snowstorms come upon us here in Alberta. Who's going to pick up my meds? So we
Exactly.
have caregivers providing
Mhm.
minimal supports and things that seem innocuous, but if they
Mhm.
don't get the medication, what might
Mhm.
happen to them? Some of us, we can skip a day or two. Some can't skip a dose. So,
Exactly.
so we need, most people need a little bit of support. Some people need moderate amount of support,
Mhm.
and some people need a lot of support. And
Right.
it comes in all different sizes and
Mhm.
packages. So caregiving situations are not all the same. And I believe we'll be better served if we have services and programs
Mhm.
and governmental supports for taxes based on the kind of situation that you're in, because one size fits all isn't going to cut it.
Exactly. Yeah, and
Mhm.
who decides, and even the severity of
Yeah.
of how sick you are, because
Yeah.
you might be a cold for you, but you feel like you're dying. So
Well, you bring up a great point, Sue, because sometimes I see horrific situations that I think, oh my gosh, how is this family coping? And they're coping very well. I
Mhm.
see other situations where I think, well, that's not so bad. You just need to provide a little bit of support. But
Yeah.
for some
Yeah.
reason, there is inability to cope well. There might
Mhm.
be some family dysfunction that
Mm.
is preventing a really good caregiving scenario for the person
Right.
at home. So there's all kinds of
Mm.
scenarios, and that's why we need a variety of
Mhm.
supports for family
Exactly.
caregivers. Yeah.
Exactly. And that's
And to leave them in control, leave the main family caregiver in control to help with some of this decision making, because I just it makes me cringe when we pathologize family caregiving.
Mhm.
It's not an illness. It should not show up in the DSM of, psychological issues we deal with. We've been looking after family members for years, and so the right recipe um, is going to look differently for different
Mhm.
people. But most of all, I just don't think we should pathologize
No.
what's going on. And sometimes the language that is used, we do,
Yeah. Right.
because it's going to affect all families.
Yeah.
Yeah.
Eventually, at one time or another, in a
Yeah, and
different.
it doesn't
Yeah.
and it doesn't always need to be a negative
No.
either. I
No.
mean,
No.
who do you want to care for your loved one? Well, I want to care for my loved ones to the
Mm.
best of my ability,
Yeah.
but I certainly want some supports and people to listen to me when I'm in that role,
Mhm.
which I guess I have been in that role. My
Yes, you
husband was
are.
diagnosed with prostate cancer. He's very well. We passed 5 years, but it throws you into a loop. And in the afterward, just as this book was going to print, The Accidental Caregiver, we experienced that. And so I'm like, I can't put this book out without telling our story and how we cope.
Mhm.
And my family caregiving, we're relatively young to be dealing with it.
Mhm.
Not the youngest who are faced with it, but we're in that younger cohort. So, and quite healthy, but it throws you for a loop. And I
Mm.
was certainly in a family caregiving role, supporting my husband,
Mm.
for sure. So even that psychological, emotional support that we give our loved ones, like
Mhm.
it's his body that's going through the changes, but I took on my role as caregiver. So I talk about that in the book as well. So,
Oh, wow. Well, so you've
mhm.
included some personal stuff there and some really good
Oh,
valuable
absolutely.
information. So
Hmm.
thank you so much for being on the show today, Dr. Kimberly. I'm so happy that you're here and giving your opinion and advice here too, because it just draws attention to the things we need to be thinking about. And everybody, thank you so much for tuning in today. You'll can find all her wonderful information in the note description for this program, and be sure to look her up and find out more information, valuable information. So everybody, thank you so much for joining us. Dr. Kim Fraser, you're a wonderful guest. Thank you so much. I really appreciate you being here. So everybody, thank you very much for joining us today. See you later. Thank you,
Thank
Kim.
you.